the trachea is this lucent tube here. And on an X-ray, it extends from the top of the film to where you have this kind of triangular opacity here that divides the trachea into two, and that's the carina. And one normal thing that you'll see is that the aorta causes slight deviation of the trachea to the right, okay, and that's normal. On either side of the trachea are what's called the paratracheal stripes, and there are vessels and lymph nodes that live in the paratracheal stripes. So here it is on CT, and one important thing about the trachea and the carina is that as you go down in the trachea, the right main bronchus has a more steep and vertical course compared to the left main bronchus. Okay, so one natural clinical consequence of that is if you have a patient who you're intubating and you accidentally put the ET tube in too far, 9 times out of 10, that is going to go into the right main stem bronchus compared to the left. So yes, this is a patient with a right aortic arch. And what you'll notice is that as the trachea goes down, rather than having that normal rightward shift of the trachea, this trachea is shifted to the left, okay? And in this patient, the reason why is because they have a right aortic arch. It's just another example of something that you might see that causes deviation of the trachea. And this one, you'll see this abnormality above the clavicles, and this is a thyroid mass. So here it is on CT. You have a heterogeneous thyroid lesion.